Hey, I'm Dr. Sebastian Gonzalez with Performance Place Sports Care. I'm doing a video today on de Quervain syndrome. It is a reason for wrist or thumb pain right around here. The reason why I'm doing this is actually I have a couple patients who have it currently. We don't see a ton of them here. They are common around the world, and especially with people that use their hands a lot. So it's really misunderstood what it is, so I thought I would just do a quick demonstration since it's pretty easy and I have a little free time today. So what you guys are going to learn from this actual video is, I'm not going to go over any treatments, just to let you know ahead of time, because it's not one that you can easily treat yourself. And I do have some friends that see a lot more of them, and it's just an overall very frustrating case. It's frustrating to the patient, a lot of times it's frustrating to providers, just because it's not a quick one like some of the muscle tendon injuries. Now, I've wrapped up my hand, and the reason why I've done this is because there's a sheath right here. It's called the retinaculum. So what happens is, and imagine if I actually wrapped my finger into this sheath right here. Okay, there's tendons, as you can see this one right here, that pops up. They go underneath the sheath and they continue all the way down to the forearm, okay? And actually, if you put your hand right here on yourself and you wiggle your thumb, you're going to feel muscles moving, and these are muscles that move the thumb, okay? There's also some that go like this rather than this, okay? I won't go into the details of what that is because they're terms that you probably won't want to hear and understand anyways, but overall, just understand that they're the tendons that go to the thumb, okay? The reason why it gets irritated, and it's really quick to diagnose on something like an ultrasound or an MRI will also catch it too. Typically what I do when I have people come in, we check this area right here. We do a test called Finklestein's test, which is basically going like this, like this, like this, and then you go like that. And all of a sudden this whole thing lights up and they start jumping, okay? And a lot of times it'll hurt when you have resisted extension on it, but also in this motion, kind of like spreading the hand away. Both of these can become painful. Now there are a couple of the conditions that can be creating stuff like this. Number one is intersection syndrome. So a lot of times when tendons cross, they have the potential of irritating each other. So there are muscles that cross up here which create intersection syndrome. Technically de Quervain syndrome, which I will put links under the video, is down in here. And what happens is the sheath, and the sheath is a thing that you can see mainly on ultrasound, which is really cool to see. And I'll see if I can find a picture and put it on this video. But when the tendon goes underneath, there's also a sheath around it. Think of a water weenie, and if you're not old enough to have played with a water weenie, it's basically, think of a water balloon with a hole in it, kind of like a long donut. So when this thing goes through there, the sheath can be really large or it can be really small. And when you look on an ultrasound, you see that this sheath is just engorged. It's huge. It's black, and a lot of times it's speckled full of colors, which when you have ultrasound, when you have a Doppler on it, a lot of times there's colors that go in there, which really indicates that this is de Quervain syndrome, okay? This is the first test we do. The second one I'd say is we just check an ultrasound, okay? It's really quick to do. It doesn't take any more than 10 minutes, and you can check for intersection syndrome as well. Now, the other thing it could possibly be is if you take your finger here and drop it into this is what we call the anatomical snuff box. It's here and here in the gully in the middle. You stick your finger in there, and if you roll all the way down, you're going to feel that it eventually dives off into kind of like a no man's land. It's a soft area. Now, this is an area where the carpals of the wrist reside, as well as ligaments and some other types of important structures down there. So it's not technically a tendon down there, but it can be locally irritated because there's local irritation right here, meaning that this area is pissed off, so it pisses off its neighbors as well. So you stick your finger in there, and now there's a possibility that it's going to be a wrist issue. And we treat these ones a little bit differently. A lot of times people go in and they eject the actual tendon and decrease the size, but a lot of times the wrist things can be simply fixed with things like joint mobilization, hand strengthening, and so on. But here's the typical progression I take with people with de Quervain syndrome, since that's the major topic we're talking about. Okay? Number one, we have to get the sheath to decrease. And how the sheath decreases is we decrease the amount of offending actions. A lot of times people who have kids, they call this nursing wrist, I think, or basically like a mommy or daddy wrist. So they're kind of holding right here, or they're picking their kid up like this, and a lot of times they irritate and overuse this area. So they might choose to use a brace or stabilize it somehow with tape, which I won't demo in this video, so that they don't continually irritate it. Okay, so that's step number one. Step number two is we have to assert some type of load upon the tendon, since a lot of times it's been used and unused and guarded for a long time. So usually sand digs or rice digs is good. So you get a bucket of sand here, and you basically just churn your hand in it like this, okay? And you might flick, you might churn the other way. There's a whole other video series on wrist and hand exercises that we could do, which I won't go into today. But for the most part, here's the thing why I'm talking about it, is because we have to be able to assert some type of load upon the tendon at some point. The collagen remodels in the area based upon the amount of load you put upon it. And a lot of times flare-ups happen when you have no activity and you're like, you know what, I'm gonna go play tennis. And you have a huge spike of activity, okay? But really we have to have a general increase like this, a linear fashion. And you have to put a load upon it slowly and in a controlled setting to not have those extreme flare-ups and then decide all of a sudden in life you don't want to play tennis anymore, or you don't want to hold your kid, or all that type of, or you start to change jobs, or you make it a workers' comp injury, or whatever the heck it is, okay? So the first thing is decrease the mechanism, decrease the flare-up, okay, number one. Second is we have to increase muscular time under tension. And lastly is we have to find that offending motion, okay? A lot of times your kids will grow out of the stage where you have to hold them, so a lot of times it'll go away. But this is basically what it is, okay? Sometimes what they'll do, and they'll go through and they'll modify this area surgically, okay? I always have the thought process that you can do a surgery, and this goes for everything else, but you have to earn the surgery, okay? You have to do everything in your power non-surgically to earn the right to do the surgery. Because there's no guarantee the surgery works either. Just like with rehab, there's no guarantee in medical that any of it works, but we do our very best. So I hope this was helpful with the Quervain syndrome. I know it's probably a more boring video than you were looking for today, but realistically, it has a lot of information on it that I didn't need to type and proofread, so I'll get it out to you quicker. So if you haven't already found my feed, I do a lot of I don't want to say self-help, but I give you tips, tricks, life hacks along the way, because you're technically not allowed to do your own medical. It's just the law, okay? So it's mainly tips to educate you guys, but there are ways that we rehab sports injuries in the clinic here. So go ahead and subscribe. There's going to be a logo somewhere at the bottom of the page here, and I'll put some links below where you can access an article when I finally write it on the Quervain syndrome on my website. So hope this was helpful. Share with friends. Thumbs up if you like it, and I'll talk to you guys soon.